Ugly veins have questions. We have answers for you today. Dr. John Rossi with Calcaño and Rossi Vein Treatment Center is here in our hot seat as we play Ask the Vein Expert. Welcome back, Dr. John Rossi.
Amy, how are you?
You probably get a lot of questions, don't you?
Yeah,
question
we
after
do.
question after question.
we
So
do.
let's go through some of them
Sure.
today that people
Sure.
have submitted to you. Number one, this is from Anna from Palmyra. She asks, are varicose veins really something I should worry about, or are they only a cosmetic issue?
That's a really common question we get from patients, and it's also a common misconception. The varicose veins themselves are just a surface manifestation of a condition called venous hypertension or venous insufficiency, which causes symptoms in your legs: heaviness, aching, fatigue, swelling, restless leg syndrome, skin damage, even ulcers and clots in the end stages. And so just because you have the veins, it's not necessarily just that they look bad, but they can damage your legs and cause problems.
Okay, so that's why we want to see an expert. Here's a good one. I thought this was good. Are men at risk for developing varicose veins? David from Mechanicsburg asked that because I do tend to think of it as a female issue.
Yeah, actually, if you look at the statistics, at the age of 60, about 70% of the women will have venous reflux, which is what causes varicose veins. About 40% of the men have it. And so it's a little over half the number of men that have it than women, and it's genetic. So if one of your parents has it, you have about a 50% chance of getting the condition. If they both have it, you have about a 90% chance of getting the condition. So it's actually very common.
Very good. Okay, here's another good question I thought. What can happen if I overlook my varicose veins? Beth from Lebanon wants to know that, and we've established not just cosmetics, so what if you don't take care of it?
Well, it will be relentlessly progressive. And so, you know, the symptoms will come on. You'll have fatigue, aching, swelling, heaving, and the thing that really is an issue is it starts to damage your skin. And once that starts to happen, that's not reversible anymore. So you want to treat it before that stage, okay? Because you don't want to wait till you get an ulcer or you get a blood clot or something like that.
Okay, that's a really good point. Here is a question from Rose from Camp Hill. She asks, are compression stockings and elevation cures for varicose vein? I bet you're going to say no.
Yeah, they're not going to cure it. You know, squeezing your legs with a stocking might make your symptoms feel a little less, and you might feel better with that. And unfortunately, elevating your legs is pretty impractical unless you turn into a bat. I mean, we all are on our feet all day, and that's just the reality. So gravity is always going to cause that effect. And so eventually, you know, you're better off having the non-invasive technology used to treat your veins.
Okay, we have in the past talked about the venous closure procedure on the show. And here's a question. Julie from Selinsgrove wanted to ask specifically about that. How long will I be laid up after the venous closure procedure?
Yeah, venous closure is a catheter procedure used to treat your veins. And typically patients are done and they go home that day. They're asked to walk right after the procedure. And really there is no downtime, okay? We encourage them to go right back to their normal activity. Usually they will not need post-operative pain medications, and most patients will tell you that their legs feel lighter after they take 4 or 5 steps off the table. So it's pretty dramatic for patients.
Wow,
and
that
it's
is
really,
dramatic.
yeah, it really is, and they do great with that procedure.
Okay, finally, just if we want more information, maybe can chat with you more about this, you have something you want to tell us about coming up.
We have a vein screening next week, Tuesday and Wednesday, 24th and 25th of March, from noon to 7, and it's an opportunity to ask questions and see if potentially there is anything wrong with your legs and that you might have varicose vein disease.
It's a great opportunity. Thanks for playing along with us again today. We'll have more questions for you next time probably.